Hi MPA members, I'm Lindsay Ricciardi, current president of the Nevada Psychological Association. NPA has been extremely busy lately, and I wanted to take a few moments of your valuable time to update you and let you know what's been going on with NPA. On the legislative front, NPA has been extremely busy, both on the state level and the federal level. As our 77th legislative session is in progress right now, NPA, with the support of Brian Gresh, our lobbyist, and Judy Phoenix, our legislative chair, we've been watching closely for any bills that drop that are pertinent to psychology. Some of the bills that we've seen come across have to do with things like human trafficking, juvenile sex offenders, reporting laws as they relate to gun control. So these are pretty hot topics, and NPA is prepared to testify if necessary to support psychology. We've also been having conversations with the new administrator of Medicaid in an attempt to try to allow pre-doctoral psychology interns to be reimbursed for their services, obviously under supervision. Currently, licensed marriage and family therapist interns and social work interns are able to bill for services under supervision, and pre-doctoral psychology interns cannot. What we're hoping is that if we're able to change the Medicaid manual to allow psychology interns to bill, that this will open up the potential for more training sites, particularly through the NPA Training Consortium. We would attract more interns, and as we know, if we attract interns, they're more likely to stay in our state as full psychologists. And that's really important because our whole state of Nevada has 390 licensed active psychologists as of today. On a federal level, NPA just sent its largest delegation ever to APA state leadership in Washington, D.C. So there were 7 of us, and the state leadership conference was focused on the role of psychology in healthcare reform. And we had the opportunity to lobby on Capitol Hill on behalf of the profession. Some of the issues that we were lobbying for, in particular, we want to be included in the Medicare definition of physician, and this would allow psychologists to have some of the same incentives that are being offered to folks included in that Medicare definition, and that includes dentists, chiropractors, osteopaths, traditional MDs. So that's one thing that's important to us, because there's incentives for including healthcare records, and there's also incentives for serving rural and underserved populations, and psychology doesn't have access to those. We also took the time to educate our lawmakers about what psychologists do and our value in healthcare reform. We also objected to the SGR cuts, or sustainable growth rate cuts, which we've narrowly averted for almost 2 decades. But if these cuts do go into effect, it would be pretty disastrous for not only psychology but healthcare providers in general. As it is, it's incredibly hard to find a psychologist who accepts Medicare currently. And so that's some of the things that we did as far as lobbying, and the conference was focused on, again, healthcare reform and psychology. So we left feeling really invigorated, but also it was a little bit unnerving. We actually had heard that, if we don't act and get a part of healthcare reform, we might not have a profession as we know it 20, 30 years down the road. So it's really important that we're educating our community about what we do and our role. That's why the CE committee, with the leadership of Melanie up in the north, Melanie Crawford, we are bringing you our annual conference will be navigating the changing landscape of psychology, and we're bringing you 3 amazing speakers. Catherine Nordahl is our keynote speaker. She's the executive director of the APA Practice Organization, and then we have David Antonuccio, who will be talking about psychopharmacology and some of their marketing efforts, and how that impacts psychology. And then also we have Stacy Tavino, who is at the Boyd School of Law, and she'll be talking on a statewide level about mental health parity, and so that's really important as well. So we hope to see you there, and we also have our annual business luncheon meeting on that day and our student poster presentations. So it's a really important day for our profession and our state, so please try to come. The following day we have strategic planning, where everybody is invited who's interested to take a more leadership role or get more actively involved with the state association. In the meantime, what I want to ask of each and every one of you is to work on educating your peers, educating the community, other professionals, your lawmakers about the importance of psychology and what makes us unique. There's a misconception that psychologists are high-paid therapists or doctors that can't prescribe. And so we really need to change that and educate people that we're trained to critically evaluate scientific research, and we're trained to develop interventions and test their efficacy. We're trained in scientifically supported treatment methods for things like pain and insomnia. And so we could play a really critical role in healthcare, and we need to position ourselves in that way. We also are the only profession that can do formal neuropsychological testing. A lot of people don't realize that. We're also highly trained to supervise very often in our programs, and so we could be supervising other professionals who are delivering services. So there's lots of things that we can do in our profession, and we just need to let people know why we matter and why our profession is so unique and important right now. Our membership is thriving. We increased 25% over the last year, so we're up to 250 members, and I'm proud to say that 22% of those are early career psychologists and 19% of those are student members. But where we're really lacking is in our licensed members. Right now we have less than 30% of the licensed psychologists in the state are part of our organization. And I think a lot of that has to do with just not understanding how hard NPA works for our profession and for each and every one of you. So the other thing you can do is talk to your peers who aren't members of NPA and explain to them the benefits of membership and directly where their membership dollars are going and how much we're working on their behalf. So thank you all, and I look forward to seeing everybody at the annual conference. Bye.